afternoon, everyone, and welcome to our third segment in our spotlight on congenital heart disease. Today, we're going to be talking about pregnancy and CHD. I want to remind everyone to please use the chat box if you have any questions or comments or messages of support for our panelists. Please type them into the chat box. We'll be able to see them. And hopefully towards the end of the conversation, we might be able to incorporate some of your questions at the very end. I also want to remind everyone that if they want to learn more about the 2021 Heart of the Hamptons campaign, please click on the link that was just shared in the chat box to learn more about that event. And now it is my pleasure to welcome our 2021 Heart of the Hamptons campaign chair and a CHD survivor, Cristina Civetta. Welcome, Cristina, and take it away.
Thank you so much. And wow, I'm so happy to be here tonight with everyone. It's been a really, really cool journey. We have had these 3 webinar series, and we kind of started with a fellow survivor who's in my age group, who's kind of just talking about what it's like for us to become adults, to go through CHD and become adult congenital heart disease patients. And then we were able to meet someone going through her transition of being a teenager. And that's just so great and exciting. And so we really thought full circle is, and Dr. Zaidi will shed more light on this, and our amazing survivor is also here with us. We were talking about pregnancy in congenital heart disease patients, because like how we started, they only thought people like me and Jennifer and everyone we've met in this series could only make it to teenagehood. Now we're getting full lives, and now we're being able to be mothers and bring in new lives. So Dr. Zaidi, get in here and let's get going.
Hey, Cristina. Hey, guys. Thanks for doing this, and thanks for having me again. So first of all, again, thanks to the AHA and to Cristina for hosting and for everything that you've done. I mean, you've done some tremendous work, Cristina. So thank you for doing that. You're absolutely right. I mean, it's been a tremendous journey, at least in sort of the last few months, where we've gone through a couple of different webinars. And you're right, bringing it to pregnancy is sort of bringing it sort of full circle in essence, right? It's sort of the cradle of life. You sort of start as a child, as an infant, you go through transition, you become an adult, and you sort of bringing it all back. Right. So I think it's very, very important to talk about it. I know Jennifer is on. I thought I saw her, but now I can't see her screen anymore, but hopefully she'll come on in just a second. But do you want to introduce her, or do you want me to do it?
Well, yeah. So, I mean, we thought it would be great for our, survivor who is going through pregnancy or who went through pregnancy to be one of Dr. Zaidi's patients, because he kind of knows the ins and outs, and he can talk us through kind of what it's like making those decisions, and Jennifer can. And I think it's such a great topic, because I am hearing more and more of people who do have heart disease having, perfectly healthy pregnancies. So we're so lucky that Dr. Zaidi brought us Jen. Jen and I have found so many commonalities, it's crazy. But anyway, so please join us, Jennifer.
Hello, everyone.
Thanks for being here with us.
Thank you for having me. I'm very excited to be a part of this.
Absolutely.
Jen, thanks for doing this. I'm going to let you and Cristina start off, and then I'll jump in a second.
Sure.
Well, okay. So I guess, the big thing is to ask you, what was the process of deciding you were going to have a baby, right? Because as heart patients, we kind of are just trying to be healthy every year. And so, to carry a child is such a big decision. Yeah. I have so many questions, but I kind of want to know, your experience through it. And yeah.
Sure. So I was born with a rare congenital heart disease called Epstein's anomaly. It's a structural issue with the heart where the tricuspid valve sits lower in the heart. I came out blue, so that's where the first diagnosis was. And I was rushed over to Columbia Presbyterian in New York City and spent 10 days in the NICU there. Growing up, it was a normal childhood. We, younger, going to doctor's appointments, we never really talked about pregnancy because I was so young, but knowing as a kid, I always wanted to have a family. And then when I met my husband, that was something really strong that we felt. But of course, knowing the heart issue and how much of a struggle that is and how important that is for myself and to carry a full-term baby, that was something we had to consider and make sure that was doable and not a complete risk to myself.
Yeah. So what did you kind of go through to make that decision? I mean, were you talking to Dr. Z? Were you talking to a lot of high-risk OBs?
Yeah, so I leaned a lot on Dr. Zaidi, his amazing team. OBs down here, I'm down in South Jersey, and Dr. Zaidi's up in New York City, so it's a 2.5-hour ride. But knowing the connection that we had, just him following me through this journey, I felt very comfortable with him, and he tells it how it is.
That's for sure.
Yeah. So he shared all the risks and what could happen to me, what can happen during pregnancy, most importantly after pregnancy, what could happen to my heart. I've had 4 open heart surgeries, and right now my tricuspid valve is replaced with a pig valve. My last surgery was in 2008. So right now I'm going on 13 years on this valve. And they usually say it's 10 to 15 years you get out of it. So I'm like pushing the end right now.
Right.
When we had my daughter, Brielle, I was about 9 to 10 years into the valve. So it looked good. And during all the tests and everything and leading up to talking about getting pregnant, my heart was in a strong state. We felt it was a good time to do it. And if we wanted to do it, it was like, God's telling us, okay, you got to do it now because this is the perfect time for us now.
Yeah.
So, Cristina, can I jump in for just a second?
Yeah.
I'm going to take Jen back a couple of years just so that we can sort of go through this journey, set it together, Jen. So Jen, I'm going to take you back. I'm going to take you back. Let's go back 10 years or 15 years back. And, I'm not in the picture. You've not met me. And this is for Cristina too, but I'm going to go to you first, Jen, and then I'm going to come to Cristina. As a young woman, as you're going through your sort of teenage years and maybe your early adulthood in your 20s, at some stage, as Cristina said, you started thinking about having a family and you sort of thought that I want to have a child. Walk us through that. What thoughts were going through your head as to what this meant for you, what this meant from a heart standpoint, what you felt, what pregnancy would do to you, or what it would do to your heart? Mm-hmm. Walk us through that before I came in or before any CHD doc comes in. Right. As a 20-year-old, as a 22-year-old, what thoughts were you thinking?
Yeah, I honestly, in my mind, with the disease, with, the heart defect that I have, I never let it limit me. And knowing that growing older, wanting to have a family, I never really thought that, oh my gosh, there could be a possibility that I might not even be able to have children. It was said as I was younger that yes, you can have one. It was more like we'll have to see later on in life. It was never said, no, you can't, it's not happening. So I kind of leaned on the fact that it was a possibility and it was going to happen, and staying positive and wanting a family and driving to that. That was very important to me and my husband, and creating a family and living our life like that. So I didn't really let it get to me. Going to doctor's appointments, the risk, a normal woman can have a baby and there's a 1% chance of having a congenital heart disease. If you look at women with Epstein's, the heart disease that I have, it's about a 4 to 7% chance. So in my eyes, it's not that big of a risk to me. If you look at the other end, the cup is half full really, where it's, yes, it's a possibility, but it's not 50-50. It was more leaning towards the positive end, that you can get through this as long as your heart's in the best shape it is, your body, your state of mind is in the best that it is, it can happen.
So Cristina, I'm going to bring the same question to you. I know you haven't been through sort of the same journey as Jen has, but being a young woman yourself, what thoughts have gone through your head when you sort of think about pregnancy or what it means to you? I know these are sensitive questions, so but I gotta listen. Trust me, I do this. I bring these questions up with many of our patients, but you guys are phenomenal, both of you, that you're having this conversation with us on a webinar. So tell me what thoughts went through your head?
Yeah, well, I mean, I feel really similar to Jen in the sense that I've always, like I've said on past webinars, my parents really taught me, you're the same as all your best friends. And, like you don't have limits aside from certain limits I had and having to go to the doctor a little more and having really wicked scars. But, I do think it like my early 20s, I didn't feel in such like a rush to like get married and have a family because I didn't know if that was 100% going to be possible. No one ever said, just like you, like, no, 100% no. So I wasn't like, oh, I'm not gonna, but I definitely didn't feel that same, like, okay, I'm 21, like, gotta settle down and like start a family because, I think that was the main difference, but I've always wanted to have a family. And honestly, when my nephew was born, I moved to Italy and was with him, and that really made me feel like, oh my God, I definitely want to have a family. But yeah, I've kind of always gotten the same, you got to do it while you're the healthiest,
Yeah.
Right.
Yeah.
Right. No, so the folks who are listening and the families who are listening, and this is something, and I won't get too scientific with this, but one of the things we have to keep in mind when it comes to women with congenital heart disease and who are thinking of pregnancy, who are pregnant, is what you guys just went through is basically a risk assessment that every woman who's pregnant with congenital heart disease or without congenital heart disease, let's say it's other forms of cardiovascular diseases, there's a risk. I mean, and we got to figure out what that risk is. So that's really where I'm going with this. But to that point, and maybe 30 years ago or 40 years ago, this was different because we have moved with time. Surgery has moved, the nuances have changed. So things are a lot better now than what they were maybe 30 or 40 years ago. Having said that, so I'm going to bring up the next question, Jen, and this is, again, I'm going to start with you. I'm going to come to Cristina. I'm going to let Cristina have more questions in a second. But I wanted, this is what I want you to think about, and both of you is, as you go through pregnancy, let's say you, and Jen, for you, I mean, you get pregnant, you have a baby, you're pregnant, you haven't delivered, you're in pregnancy. What sort of support are you looking for out there? What sort of support are you looking from the medical standpoint? And what sort of support do you need on your own, on a personal standpoint? So the two different support structures. Do you see what I'm saying?
Yeah. As far as non-medical, of course, I have my husband, amazing family, parents, and friends, and just hearing their stories and how their pregnancies went and any complications that they went through. So just learning more about people without the disease, how their pregnancies go. As far as medical, I joined a lot of support groups through Facebook with my medical disease, with Epstein's anomaly. So reading on that, congenital heart disease, I joined a bunch of groups there, and I can just read and learn about other people's stories and what they've been through. And then just asking the questions to the high risk OB team and my OB down here in South Jersey. It's just educating myself and making sure that I'm making the best possible decision for myself, my family, the future, knowing that, not every day's promised. You don't know what's going to happen after you deliver it, so just having faith and staying positive and going forward with my goal of what I've always wanted.
What about you, Cristina?
I mean, for me, I think the big thing is, I've gone through different processes of talking to my doctor, Hyrit, everyone, to just really educate myself and understand before I would make that decision. And also exploring any options that are there. And then obviously from my family, it would be in some way most importantly, my husband, but also my parents to like kind of green light it, because you need that support system more than anything in some way, because they're the ones who've gotten us to this point. But I do look at my health today versus where it was, before my valves and when I'll have to get new valves. And so I think, I kind of look at also really my doctor of like, well, when are we doing this replacement? And when are we doing this? Because, they always say you got to window everything like a little bit. And, right now I'm not on medicine, but there's a chance I could go on medicine that could be good if you ended up pregnant and could be bad if you end up pregnant. So I think, like Jen's saying, obviously I'm not gone through pregnancy, but like, I think it's a thing you have to kind of think about timing and your health every day. Your health in some way fluctuates for us. And Jen made me think, because like, when I was little, I used to watch Steel Magnolias and I felt like Shelby, even though I didn't have diabetes, but like she like has the baby and she's like, everyone's against him. Then she like passes out 4 months later and I was like, I'm Shelby. My mom's like, no, you're not. But okay.
Yeah, so that's important. Again, for the reason I'm bringing up sort of the support structure is because I see it from the medical side of things, right? I mean, we see you from the medical side of things, but really from a support structure standpoint, we see you once in 3 months during pregnancy, once in whatever be the case. Really, the support structure that comes together is your significant other, right? It is going to be the person who's involved in that decision-making process. Or your, whoever else your support structure is, be it parents, but really it is your significant other at that point in time. So, which is why I was saying that, that we often forget in some ways what our significant others are going through, even though they're not you. I get it, but their support is important. So, so that was one part. The other part that I wanted to bring up, and I want to hear both your thoughts too, and promise, Cristina, I'm going to shut up after this. It's
awesome.
You're
asking the right question.
No. That's again the question for you guys. Is the medical support structure? Why is that? Is that something you thought about? Like, well, if you get pregnant in South Jersey, do you have the right team who's going to get involved with your care? Or Cristina, I mean, you're in the city, so it's a little bit different because you have access. But so I'm just trying to think as you went through pregnancy, did you think about who's going to take care of you from a CHD, ACHD standpoint and a high risk OB standpoint? Where will you deliver? Who's going to take care of the delivery? What's going to happen sort of post-delivery? Did those thoughts go through your head? So Jen, I'll start with you again.
Yeah, definitely. So down here in South Jersey, my normal OB is in Manahawkin, New Jersey, but I would see them every 4 weeks. And as you get closer to delivery, you're seeing them more often. I haven't been with them forever. Like I've been with my congenital team and my cardiologist since I was born. We've switched on and off, but New York City knows my story. A lot of doctors know my story, and which I'm so grateful for. And to me, I felt like it was so much easier. They know everything about me. I also have a pacemaker, so they know my settings. They know everything in New York. So yeah, I have a pacemaker since 1998, I guess. It's been a while. But I have trust in South Jersey, but I've just been with my cardiologist team for so long that I have all the faith in them that they know if something's happening during pregnancy or delivery, they know exactly what they need to do because they have all my information. Yes, of course, my South Jersey OB has it as well. He's phenomenal down here, and I feel so comfortable with him, and he got us to have Brielle, my daughter. So, I just knowing most of my surgeries have been done in New York City, I felt most comfortable being with them. I felt home basically in New York City with having Brielle up there.
How old's Brielle again?
She'll be 3 in May.
23. Oh my
yeah.
God. That's the best age.
Yeah, it is. Comes up with she has some fun words that she says now in sentences.
Oh, that's so cute.
Yeah.
So same thing for you, Cristina. I mean, I know you haven't gone through the process, but have you thought about again, the reason I'm sort of bringing up these questions, especially with those people listening, is that if there are young women out there who have congenital heart disease, who are thinking about pregnancy, how do you think the healthcare team should be structured and how should they get involved and things along that? That's what I'm trying to get at, is that the reason I'm sort of going down this route is because this is in essence considered high risk pregnancy. I mean, you can sort of stratify it, but so Cristina, to you, if you ever got pregnant or you decided to go down this route,
yeah,
what are your thoughts about who do you need? What sort of doctors do you need?
Well, I think, first and foremost, I think the, Dr. Rosenbaum, who's taking care of me, who, for the last, I guess, over a decade, he's been there through my pacemaker. He was there through my double valves. He knows everything. And anything, any little thing comes, it's like, come see me. He's not an alarmist, but he's like conservative and careful, which is also why I think, if he said green light, I feel green light is good, so I think it would be him. And then obviously I've been with my same OB since I was 16.
Right.
So I like everyone she recommends is like always been amazing for me. And I think the great thing is now Columbia and Cornell have like merged, so they all share information. So for me, it's made it pretty easy because everyone can get in touch. But I mean, I think, you know, right away, just even years ago when I was like, oh, I don't know, maybe like babies, I don't know. And, you know, my doctor was like, okay, so like, I want you to talk to this, you know, high risk, because that's what you'd be. I want you to talk to this, you know, specific cardio high risk doctor, OB. And I was like, you know, I think it's having your team who, you know, you can ask them anything and they know you. You know, I think that's so important, you know, even my surgeon's up at Columbia. So obviously if he had to weigh in and say how he did it, by the way, Dr. Z or Dr. Zaidi, I don't know why I keep calling you Dr. Z.
It's fine.
But sure. Jen and I are the same surgeon. Did you know that?
Yeah, for the first three surgeries, I had Dr. Quajapur.
I wouldn't be surprised.
And he's crazy. The one who did my surgery last.
So what I'm hearing, the reason I was taking you both down this sort of question was really for others who are listening and whoever listens to it down the road, is that what Jen and Cristina, what you guys both just said is really that what you need is a team, that you need a team that's going to come together on a medical standpoint to provide the care that young women with congenital heart disease need during pregnancy and at the time of delivery. And what that team is, sort of just being a little scientific about it, and then I'll stop being scientific about it or medical about it, is that really that's a three-pronged approach, in the sense you need somebody from cardiology, be it an ACHD doc, and preferably a CHD doc who's involved in your care and who's sort of experienced or has experience with pregnancy and congenital heart disease. Two, you need a high-risk MFM OB doc who can sort of handle when it comes down to delivery, as to sometimes it's going to be a vaginal delivery, sometimes it's going to be a C-section. Every once in a while, things may or may not get a little hairy when it comes to delivery. And then the third part of this that we don't sometimes talk about very often is anesthesia, as to how we're going to use anesthesia during that sort of delivery process. And then the last part of this is where we deliver patients. And those of you who are listening, sometimes it could be in their labor and delivery floor. Sometimes it can be in other places, in ICU, sometimes rarely so, or things like that. So what I'm trying to get across is what both of you just said, is that to get women with congenital heart disease through pregnancy, it's really a sort of a team-based approach, because without having that team-based approach, sometimes it gets a little, it can get a little, you know, sort of topsy-turvy. Yeah, that's sort of what you guys just said. So, all right, that was me being medical and scientific. Cristina, I'll stop this. I'm going to hand this back to you.
Oh, no. Well, I wanted to ask Jen, because I find, you know, obviously my parents, and I said it on the last webinar that, you know, it wasn't until I married my husband, who they trust implicitly, that they were kind of like, okay, we're not going to go with you to the doctor's appointment, but like, you'll call us when you get out. And like, you know, they're on it. And I talk to them every day, and I wouldn't have it any other way. So I was wondering, kind of like, how did they feel when you and your husband, or just you, said, we want to have a baby? You know, were they part of that process? Like, I think that's interesting for people to hear, you know, kind of.
Yeah, definitely. So we had kept them informed. Same thing, like when you're out of the appointment, you're calling them right away, because they're saying their prayers that it's another good appointment, and getting some good information after, you know, echoes, and making sure the valve is still holding up. It's like a timeline, basically. You know your years of how much you have. So it's, you know, you're getting towards the end. All right, you're almost like waiting for, okay, it's going to be another surgery. But so we always kept them informed. They were excited, obviously, but also very cautious and concerned, and being that they've been in all the appointments all the way up until, you know, my husband Brian was in the picture and then got married. It was almost like passing the torch over to him, that he had to take over. My parents would always have this notebook, and it was like we passed the notebook off to Brian, and Brian had to now take the notes. And just having that support person in the room with you, like, there's so much information that's discussed in these appointments that you need to have that person there for you to take the notes and just remember what was discussed. So with my parents, they were excited, but very cautious, and, you know, they were always a phone call away, and I was always updating them on the process and what what was happening and what the next step would be and the condition of the valve. And, you know, they were always there because they had been there from the beginning.
Yeah. That's so, and I have another random question because I realized I never asked you. Did they do extra testing on Brielle while you were pregnant with her, heart testing specific?
Yeah.
That's a very good question, Cristina.
Dr. Zaidi.
Good job. So yeah, I went through all the normal testing with having a baby, where you do like your beginning scan to show the growth of the baby, the heart rate. Your 20-week scan is your anatomy scan. And then as you get to the end, I was going through like non-stress tests to just monitor the baby, the movement in the heart. There was also with me a fetal echo, which was done between 22 to 24 weeks. That's where you really see inside of the heart. And basically up until that appointment, we were on pins and needles because there's a risk that she could carry what I have or have some type of disease. So we did get clearance, thank God. She is perfect, has the best heart ever. So yeah, around 22 to 24 weeks is when we went for a fetal echo, and it's amazing. You see inside of the heart and the different chambers and how it's flowing, and we got the clearance from her that it was absolutely perfect.
To Cristina, that was a great question, because I'm going to segue into sort of what you just brought up this is going to be again for both of you. I'm going to start with Jen again, is that what Cristina just said is, did you think about what was going on with the baby? So what that means in essence is the risk of transmission of congenital heart disease. And Jen, just you tell me first, I mean, how did you think about that I have congenital heart disease? I've gone through so many operations. What if this happens to my child? So walk us through that. Tough question, huh?
Sure. It was nerve-wracking because I'm waiting to see that heart echo and waiting to know that everything was okay. And, you know, knowing everything that I've been through, all the surgeries, the doctor's appointments, how much care I have and the support group around me, like it's a lot. And of course I want a healthy baby. If she had some type of defect, that's okay. We're going to get her through it. And I've been there, so I'm the best person to be by her side and get her through it. But thank God that she's healthy, and it was such a relief after that middle 24-week scan.
That's so awesome.
Yeah, no, that's so again, Cristina, as you brought this up, I mean, I'm just wondering, have you thought about, so if down the road, if and when, if this happens?
Yeah, I mean, I think, you know, I always think my heart disease is kind of my greatest gift to me in some weird way, because I've always really appreciated life and like taking care of myself, maybe sometimes more, and like, you know, just really appreciate everyone and everything in my life. And I think, you know, we're also, you know, Jen's a little younger than me, but we, you know, were born in a time where we were the people who, like, we were lucky if we were getting to be teenagers. And now it's like, you know, they can go in there. I mean, I was reading all these different things, and I know they can go in there when the baby's, you know, inside of you and do little heart, you know, surgeries, or they can be ready for you and all these things. Whereas when I came out, no one knew. So, I mean, to me, I think, you know, you would just kind of be like, all right, well, I'm a pro at this, so I got this. But yeah, it's definitely, I'm there with Jen that it's the most nerve-wracking thing ever, because, you know, that's what my parents said. You know, they didn't know, and it was terrifying. And the first, you know, 3 years of my life, when I was almost dead a few times, they, you know, they said they would never wish it upon someone else. So, you know, I think it's scary, but, you know, we've really advanced so much. I mean, the Heart Association has put so much into congenital heart disease research and continuing everything. And because of doctors like you, we're being able to, you know, have babies and live full lives. So I think I would just hope it, you know, mine would come out like Brielle.
Listen,
Perfect.
what you just said was powerful. It's powerful and it's touching, and you know, I hear what you're saying, and I'm sure Jen can relate to this. And the reason why both of you are so important and what you're sharing today, both of you, is exactly why we are doing these conversational webinars, is because we want other young women like yourself, or other men who have congenital heart disease, not just women, to think about the fact that they can have babies. Yes, there is a risk, but the risk is mitigated by having a good team that's taking care of you. And I think that's the important message that needs to get out there, is that you guys are success stories. There are women like you out there who are success stories. And the fact that you can take this forward is, again, a success story. So 30 years from now, who knows where we're going to be, right? I mean, we've made so much progress. So again, I mean, you guys are phenomenal. The fact that you guys are sharing these stories also. So.
And we are success stories because of doctors and teams like you that can get us through.
Exactly.
You keep us on track and focused, and it's really the main reason why we had a healthy baby, and I'm here today, honestly, or at least was able to have him.
Exactly.
Yeah, it's so here's a question for both of you, and I think we're a little over time, but I just want to bring one more question to both of you. And Cristina, maybe I'll start with you first, and we'll go to Jen. Hearing what you've just heard, what you've gone through, the thoughts you've thought through with your parents and with Ed, and is like, what would you tell another girl or another young woman or a young man out there with congenital heart disease when it comes to thinking about a family?
Sky's the limit. Do it, just as long as you have the right people. I mean,
Right.
I think if you for anything with heart disease, I think if you have the right team and you feel confident that they're giving you sound advice and that they're going to help you put together that team, there's no reason not to. If that's what you dream to have, then whether it's, through pregnancy itself or through a different form, if you want to have a family, congenital heart disease is not the thing that will stop you from that, I think.
Yeah. What about you, Jen?
Yeah, just telling other women to have hope. It's possible. Learning stories and hearing from other people with the defects that they've had, but they strive through it and they don't let it completely control them. Living your life every day and thinking positive, and it's possible. And to have that support with the doctors and know the timeline, know exactly, okay, I'm healthy, this is a good time to do it. You have your support team with medical side. It's possible. It can definitely happen.
Yeah.
Yeah, no, I think that that's the message from both. And again, I thank you both, is because that is the message that needs to be heard, is that it's that young men and women, if we're talking about pregnancy, so it's going to be women with congenital heart disease, can go through this. And yes, it's what did we heard? It's nerve-wracking, it's stressful, it's, there are people around you who are worried, you are worried, but it can be done. And it can, so I'm not saying do it. Listen, I'm not saying do it with no mitigated risk. I'm not saying that. I'm just saying do it, but do it carefully and have the right team working for you and with you. And that's sort of the message that needs to get out there. So that's sort of my 2 cents. Cristina, I'm going to hand this to you. I know we're going over here, but I'm going to get this back to you.
Well, I know we're going a bit over, so I think I will say, Jen, are there any great words of advice, being that you've gone through pregnancy for heart disease, fellow heart disease ladies looking to, make a baby?
Just, you're stronger than you know. It's possible. It can happen. And if that's what you dream of, and that's really very important to you, like it was for me, it can happen. And to just, keep trying. There's going to be struggles. You've had struggles your whole life. It's not ending there. There's going to be complications or some type of hiccups here and there, but your team of doctors will get you through it, and they'll be right by your side to calm you through it, keep your nerves down, and deliver a healthy baby and a healthy.
Awesome. And so then, Dr. Zaidi, to really bring it full circle and close it, what is your advice to girls who want to get pregnant, who have CHD? But small advice.
Small advice, yeah, small advice. So listen, the first thing, I've always been, and I've been an advocate for women and men with congenital heart disease, but certainly women with congenital heart disease who are carrying a baby or thinking about pregnancy or going through pregnancy. Listen, hats off to you guys. Really, this is the fact that you guys are having this conversation, and the many, many women out there like the two of you. Hats off to all of you, and not just to you, to your parents and your significant others. As I said, that support structure and having that support structure is tremendously important. So all of you. It's you should be very proud of yourself for just being here and having this conversation and taking it forward. That's number one. The second part, from an advice standpoint, and just sort of wearing my doctor hat on for a second, is that if you go through pregnancy and you have a child and you're going through it, make sure from a ACHD standpoint, you have a good team that's taking care of you from an ACHD standpoint and from an MFM or a high risk OB standpoint, and they are comfortable with your heart condition. If they are not comfortable, or they're, that's a problem, because you need to either then sort of think, is this the right team or is this not the right team, and things along those lines. But if you have a good ACHD team and a good high risk MFM team, I think you're going to be okay. And as Jen said, they'll take you through it. So it can be done. It has to be done judiciously and carefully. And you need care both pre-pregnancy, during pregnancy, and then sort of after pregnancy. So it's a process. I mean, and Jen knows this, it doesn't stop at delivery. I mean, she knows it sort of goes on for a little while post-delivery. So yeah, at no point did I say no anywhere, by the way, just so you know.
Yeah. Well, I think that is kind of part of the moral of the whole webinar, right? There's no in limits. And it's being cautious, it's using your team and guiding it right. But, I think there's no.
Yeah, there's
no.
Well, I mean, well, there are some
exceptions.
There are some instances where there is a no, but those instances are few and far between. I mean, invariably, we should be able to get a lot of women with congenital heart disease during pregnancy. But as I said, as Cristina just said, I mean, could there be a no? Yeah, there could be a no, where we could turn around and say, this is, this is not smart. Let's not do this. But but invariably, we should be able to navigate through many conditions. I'm not saying all conditions, but many conditions.
Yep. No, and I think the thing is, this webinar has been so awesome. I mean, it's been enlightening for me. And I think it's been awesome having you here, Jen. And I know we kind of have to wrap it. So, I mean, I guess, any final words, Jen?
Just stay strong. Stay strong, and it's possible. You can do it. Really.
Dr. Zaidi?
Yeah, no, it's the same thing. Listen, I got to thank you guys, both of you. I mean, you guys should, as I said, be very, very proud of where you are and what you guys are doing. And your voice should be heard by many other young women and men, as I said. So thank you both of you, for sort of sharing this.
Perfect.
And on behalf of the American Heart Association, we want to thank Cristina, Dr. Zaidi, and Jennifer. I mean, Cristina and Dr. Zaidi, you really have been amazing co-hosts for the last 3 months, and these conversations have been phenomenal, entertaining, heartfelt, and informative, and that's very difficult to do. The one question that we did receive, that I received through the email, was great. It was a comment, great conversation. Are we going to see the baby?
She's napping. I had to time it perfectly so she wouldn't be screaming and yelling.
Fair enough.
Sorry.
Well, thank you again. On behalf of the American Heart Association, we want to thank our co-hosts, we want to thank our panelists, and we want to thank you. And we want to encourage all of you to please continue to support the mission of the American Heart Association. Please save the date for the Hamptons Heart Ball. We're going to share the link one more time in the chat box for you to visit the website and learn more about this phenomenal event, of which Cristina will serve as the chair, and of which Dr. Zaidi is playing a huge part in as well. So thank you, everyone. This has been a phenomenal series. We wish you continued health, success, and really all the best in 2021 and beyond. Take care.
Thank you. Take care.
Hey, guys.